You know that sheer moment of panic when the thermometer suddenly spikes? Yeah, we've all been there. Welcome to This Explainer. Today, we are on a mission to completely demystify fevers. We're going to uncover exactly what they are, why they happen, and most importantly, when they actually cross the line from a mild annoyance into a real medical emergency. To do that, here's our roadmap for today. We'll start with the body's internal thermostat, then we'll spot the symptoms, talk about exactly when to see a doctor, how to handle febrile seizures, and finally preventing future infections. Let's get right into it. Okay, so let's set the record straight right off the bat. We've all grown up hearing that 98.6 degrees Fahrenheit or 37 Celsius is the absolute standard normal body temperature. But if you hit 99, it doesn't mean you instantly have a fever. Actually, a true fever doesn't officially begin until a mouth reading hits exactly 100 degrees Fahrenheit or 37.8 Celsius. Section 1. The body's internal thermostat. We really need to shift our whole paradigm here. Instead of looking at a fever as this awful enemy we have to defeat immediately, we should look at it as one of the body's absolute best defense mechanisms. You see, deep in your brain, there's this area called the hypothalamus. Think of it like your body's master thermostat. When your immune system detects an invader, the hypothalamus deliberately cranks up the heat. It actually forces your body to shiver to generate warmth and restricts heat loss. So when you're wrapping yourself up in 3 blankets because you're freezing, you're actually helping your body hold on to the exact heat it needs to fight off the illness. And here is where it gets really interesting. Fevers below 104 degrees Fahrenheit, that's 40 degrees Celsius, associated with run-of-the-mill viral infections like the flu, they are generally not harmful. In fact, that fever is your friend. It's a totally natural immune system booster doing exactly what it was built to do. But viruses aren't the only things turning up the heat. Bacterial infections, inflammatory conditions like rheumatoid arthritis, and even severe heat exhaustion can trip that internal alarm. Surprisingly, even things designed to keep us healthy, like routine immunizations for COVID or pneumococcal, certain antibiotics or blood pressure meds, can cause a temporary spike. And in some rarer, more serious cases, malignant tumors can also be the root cause. Section 2. Spotting the symptoms. Okay, so the internal temperature is rising, but what does the collateral damage feel like? Well, we all know it feels pretty miserable. As your body works in overdrive to generate all that heat, you get hit with a brutal combo: sweating, intense shivering, and muscle aches. It just completely zaps your energy, leading to headaches, a total loss of appetite, dehydration, and just a general overwhelming weakness. That is exactly why we feel so awful, even when our body is technically winning the fight. To know what you're dealing with, you have to measure it, right? And here, we face a classic trade-off: accuracy versus convenience. Ear and forehead thermometers. Super convenient, incredibly easy to use. But oral and rectal thermometers give you the truest, most accurate core body temperature. And that distinction is absolutely crucial for infants, where an accurate rectal reading can literally dictate your next emergency steps. Section 3. When to see a doctor. Now we're getting into the non-negotiables. For infants, even a slight fever can signal a severe infection. If your baby is under 3 months old and hits a rectal temp of 100.4 degrees Fahrenheit or higher, call the doctor. No waiting. If they're between 3 and 6 months and hit 102, or if they're lower but seem unusually sluggish or irritable, make the call. For toddlers 7 to 24 months, if a fever over 102 lasts more than a day or comes with symptoms like a bad cough or diarrhea, get them seen. These are exact, hard, and fast rules. For older kids, if they have a fever but are still making eye contact, responding to you, drinking fluids, and playing, they're usually fine. But you have to watch for red flags. If they are listless, totally confused, vomiting repeatedly, or complaining of severe pain like a headache or stomachache, get help. If a fever lasts more than 3 days, or if they have a seizure, call the doctor. And listen, if a child ever has a fever after being in a hot car, seek emergency medical care immediately. So what about us adults? We always try to tough it out, don't we? But there is a hard line where you need to stop being stubborn and pick up the phone. For adults, call your healthcare provider if your temperature reaches 103 degrees Fahrenheit. That's 39.4 Celsius or higher. But the number on the thermometer isn't the whole story. You need emergency attention if that fever brings along some scary neurological signs, like mental confusion, bizarre behavior, unusual sensitivity to bright light, or convulsions. Same goes for severe physical distress. We're talking a stiff neck, especially if it hurts to bend your head forward, a sudden rash, persistent vomiting, severe chest, abdominal, or urination pain, or trouble breathing. If any of this happens, don't wait around. Get to an ER or urgent care immediately. Section 4. Handling febrile seizures. Now, let's talk about something that is probably every parent's worst nightmare, a febrile seizure. Children between 6 months and 5 years are at a higher risk of having a seizure when a fever hits. They might lose consciousness, their limbs might shake on both sides, their eyes might roll back. It is absolutely terrifying to watch. And about a third of kids who have one will have another within a year. But here is the deep breath you need to take. The vast, vast majority of these seizures cause absolutely no lasting effects or long-term damage. If it happens, you need a plan. First, calmly lay your child on their side or stomach on the floor. Move any sharp objects out of the way and loosen any tight clothing. Hold them gently just to prevent them from hurting themselves. Never, ever try to stop the physical movements, and don't put anything in their mouth. Call 911 if it lasts more than 5 minutes or if they don't recover well afterwards. And always get emergency care if it's their very first febrile seizure. Section 5. Preventing future infections. Finally, how do we stop this whole chain reaction before it even reaches the hypothalamus? Well, your first line of defense is simple: vaccines and hygiene. Get your recommended flu and COVID vaccines and follow public health guidelines. Wash your hands thoroughly and often with soap, carry hand sanitizer, and please cover your coughs and sneezes. Above all, try to stop touching your face, especially your eyes, nose, and mouth. Those are the VIP entrances for the pathogens that start all of this trouble in the first place. And that brings us to the end of our explainer. We've covered a lot today, from the incredible defensive power of your body's internal thermostat to the specific symptoms and red flags that mean it's time to get professional help. So here's my question to you. Next time you feel it chill and that thermometer starts creeping up, will you recognize it as a friend and let the fever fight? Or is it time to pick up the phone and call the doctor? Apply what you learned today, stay safe, and stay healthy.